Knee arthritis is a common cause of knee pain, and individuals who have painful arthritic knees will come to one of three options in terms of treatment. They'll either self-manage their pain, possibly they'll consider injections, or the final option is knee replacement surgery. The incidence of people needing knee replacements with knee arthritis is increasing in the population, and there are lots of reasons for that. People are coming to knee surgery at a younger age with knee arthritis. Again, there are a number of reasons for this. Traditionally, with knee arthritis, the most commonly performed operation is a total knee replacement. Knee replacements can be full knee replacements, which are called total knee replacements, or they can be half knee replacements, which are called partial knee replacements. The difference between the two is that if the arthritis is localized to one part of the knee and that matches with the symptoms that the person has, then potentially we can consider a half a knee replacement. But the most commonly performed arthritic operation is a total knee replacement. Traditionally, knee replacements are a very successful operation with success rates of 80 to 85%, and knee replacements can last 15 to 20 years. The traditional way of undertaking knee replacements works very well, and this is what we commonly do in the National Health Service, and it is what we are currently doing in the National Health Service. As with everything in medicine, technology has now come to the forefront, and we now have the ability of using computerized software as well as robotic assisted knee replacements, which are now the cutting edge and the most technologically advanced surgical options that we have for knee replacement surgery. And the Mako assisted robotic knee replacements is a groundbreaking technology, and it has changed the way knee replacements will be done. Robotic assisted surgery has been around for a number of years. We've been doing it in the Northwest for about 3, possibly slightly more years. And I was fortunate to undertake the first robotic knee replacement in the Northwest. So you may have heard of robotic assisted knee replacement and you will have seen posters for it. But why all the fuss? With knee replacements, what we're trying to do technically is to make sure that the knee replacement is correctly aligned in the knee. And if you want to think about a car, if you put tyres on the front wheels, but the alignment or the tracking of the wheels is wrong, then what will happen is that the rubber on the tyres will wear out more quickly. And this is exactly what will happen with knee replacement surgery. So what we want to do is to make sure that the alignment or the tracking is optimal, is at the best that it can be. And this is exactly what the robotic assisted surgery allows us to do. The way the process works is that initially we will get a scan of the knee and the leg, and the data from that is used to create a virtual 3-dimensional model of the knee and the leg, which we will then upload to the software of the robotic system. At the time of the surgery, we will gather further real-time data, which will be added to that model that we've already created, and then that will provide the background for which we can make the adjustments that we need at the time of surgery to make the procedural bony cuts which govern the alignment of the knee replacement. And what all of that means is I can put in a knee replacement which is much better aligned doing it robotically than the evidence would suggest doing it the traditional way. Now, don't get me wrong, the traditional way works very well and there are no problems with it at all. This is just an advancement that we have where we can improve the outcome. So the outcome from the alignment is something that won't be seen for many years, because a knee replacement will take 20 or so years to wear out, and really we won't get those results until then. However, there are also short-term benefits. With the robotic surgery, it is a less invasive procedure. So what that means is that patients tend to bleed less, they tend to have less pain, they have less swelling, they tend to regain their motion more quickly so that they can bend and straighten their knee more quickly. And all of this translates to patients being in hospital for a shorter period of time. Most of my patients will go home between 1 to 2 days after a robotic assisted knee replacement. What we find is that they reach their end stage in recovery much more quickly than they do with the traditional knee replacements. And if you want to see some of the patient comments and outcomes from this, have a look on my website. There are lots of patients who provided their experiences and their journey with knee replacement surgery using the robotic system. So when you put all of these things together, I find that robotic assisted knee replacement is a much more beneficial technique for the patient, both from their end of using it, but also from our end of being able to technically perform the surgery. Ultimately, all the patient will be able to see as a result of this is that their scar on their knee is a lot shorter, but behind that there's a lot of science and technology that has allowed that to happen. A happier patient is a patient who will be able to return to their activities more quickly, whether that's that they have a shorter period of time off work, they get back to playing golf more quickly, they're back on the tennis court more quickly. But ultimately what we want to do is to allow patients to recover more quickly, and this is one of the many benefits that robotic surgery allows us.